welcome back to another episode of the Breast Cancer Physio. I'm your host, Jen McKenzie, lymphedema physiotherapist and ESSA accredited exercise physiologist. In this episode, we're going to cover the topic of seromas. So seromas are quite a common post-operative complication that can occur after breast cancer surgery. So we're going to talk about what is a seroma, where do they form, when do they form, how they're treated, how they're diagnosed, and also their relationship to lymphedema. So if you enjoy this content and you would like to see more, then please subscribe to my channel, which is completely free. Give this video a big thumbs up and leave a comment in the section below if you have any questions around seromas or any other questions around breast cancer. So first of all, let's talk about what is a seroma. So essentially a seroma is a trapped pocket of fluid. So when you have breast cancer surgery, typically they are removing tissue, they're removing tumours, they're removing lymph nodes. So if they are taking tissue out, there's essentially a space left over where fluid can fill. So you would know that if you're a breast cancer patient and you've been through surgery, that they put post-operative drains in to help remove any excess fluid after your breast cancer surgery is performed. And when those drains are removed, there's an opportunity for that fluid to still be produced by the body in the phase that it's healing. But unfortunately, sometimes that fluid can build up in that space, and that's technically what we call a seroma. So let's talk about when do they occur. So seromas typically form after breast cancer surgery, and this can be after a lumpectomy, a mastectomy, or even an axillary lymph node clearance or sentinel node biopsy. So it's most common that they will form after surgery. Occasionally you do see seromas pop up later down the track, but it's less common. So occasionally you might see one pop up at the end of radiation or through radiation, because radiation is also a time where fluid can be produced by the body in reaction to the radiation treatment. Let's thirdly talk about where do they form. So as I mentioned, even if you've had a lumpectomy, you can still get a seroma in your breast. A mastectomy would cause a seroma in the chest wall, and if you've had an axillary lymph node clearance or sentinel node biopsy, you may experience a seroma in your armpit. Let's talk about how they're treated. So if you've got a seroma that's relatively small, so sometimes less than 20 mils, often what they will do is they will let it resolve on its own. So it's most common that they will try to let a seroma resolve naturally. So the body will reabsorb this excess fluid by itself. Sometimes that can take quite a lot of time, like some months, but sometimes they resolve relatively quickly. So most of the time they're going to try and leave the seroma to resolve itself. The reason they're trying not to treat it is because with the treatment technique they use, there is a risk of infection. So the treatment technique is fine needle aspiration. So essentially they are putting a needle into the space where there's fluid and they're draining it out through the needle. So this is typically performed by a breast surgeon or a radiologist in a radiology clinic. It just depends on what way your medical team likes to go as to whether they just let the breast surgeon perform this treatment technique or whether they refer you on to a radiology clinic. But they're the two typical medical professionals that will actually perform the drainage of the seroma. Now, the problem with seromas being drained is risk of infection, as I said before. So they really are quite judicious as to whether they decide to perform the drainage or not. So if you have a seroma and you're not sure if it's big enough to drain, then that's sometimes where they will perform an ultrasound scan. So this is partly talking about diagnosis here. So sometimes if you've got a small to medium-sized seroma, then they may have had to perform an ultrasound scan to actually diagnose the fact that there's a seroma present. Sometimes seromas are very obvious, so you can feel them, you can see them, and you don't necessarily need to go off and have an ultrasound scan performed to diagnose it. However, if they're not sure where the seroma is or how big it is, or whether there's even a seroma present or not, that's when they'll get you to go off and do an ultrasound scan to confirm that. So if you have a seroma and you're suspicious that it could have an infection in it, the signs and symptoms of infection would be potentially you'll have fevers, the area where the seroma is may be red, hot, and painful. So often if you've got a really uncomfortable chest wall, say after a mastectomy, or if you've got a very painful breast after a lumpectomy, there's a possibility that you may have a seroma. And if it's very uncomfortable, if there's redness, if you're feeling unwell, if you've got fevers or the shivers or whatnot, that could be signs of infection. Now, typically if you go to your medical team, which might be your breast surgeon, or if you went to your GP, they're going to be putting you on antibiotics or a course of antibiotics to control that infection. So if you have any signs or symptoms of a potential infection, please get to your medical team, because they're going to be the medical professionals that are diagnosing the infection in the first place and then treating it accordingly. I'm just going to finish off by talking about lymphedema in relation to seromas, but also there's another condition called a hematoma, which can often be mistaken for a seroma or vice versa. So I do believe there is an increased risk of lymphedema being triggered if you have a seroma in your armpit. Now, if you have a seroma in the armpit, that's when I often will encourage the patient to get off to their breast surgeon to discuss aspiration. Part of the problem with a seroma under your armpit is that it often leaves people feeling quite uncomfortable in this region, and ultimately it can lead them to wanting to hold their arm away from their body. And as you can imagine, if you're walking around too often during the day and your arm is being held away from your body, you're going to start to get potential shoulder problems off the back of that. So this is another really important reason as to why we want to get that seroma dealt with, because we don't want long-term shoulder complications coming off the back of something that can essentially be treated. Albeit that, yes, there is a risk of infection with treating a seroma, so there is things to weigh up in the treatment of seromas, but there's also things to weigh up long term for your physical preservation of your shoulder. And certainly from my clinical experience and plenty of research done, there are often shoulder problems that come off the back of breast cancer treatment regardless of seromas. So a seroma is potentially only going to add to shoulder problems if it doesn't get treated. So let's just quickly talk about hematomas to finish off. So as I mentioned at the start of the video, guys, a seroma is a trapped pocket of fluid, which is usually more like serum. So that's where I think the word seroma comes from. It's more the serum that is the type of fluid that is going to be pulled out. However, another complication after surgery is potentially hematomas, which is where there's bleeding occurring after the surgery. So if they find a collection of blood rather than a collection of serum in the space or in the area that you feel you've got fluid being trapped, then essentially that may be a return to surgery to get that washed out. So a hematoma is treated quite differently from a seroma. Hematomas can often cause bruising as well because it's old blood, but a hematoma is quite different to a seroma. They're both post-surgical complications, essentially. They're not necessarily major post-surgical complications if they're mild, but they can become problematic if, it depends on the grade of the hematoma and the size of the seroma often, but hematomas are treated quite differently. So I just wanted to point that in this video that they're two separate things. They can both occur after breast cancer surgery and they're both dealt with a little bit differently. Thank you so much for watching this video, guys. I hope you've gained some great information around seromas after breast cancer surgery. If you have any questions, please leave a comment in the section below and I'll get back to you as fast as I can. I'll be back next week with another video. I hope you're having a wonderful week wherever you are. I'm Jen McKenzie, the breast cancer physio, and I'll see you next time.